Welcome everyone to the 6th Annual BioHealth Capital Region Forum. As you know, this year we have some different conditions so that we are going to do this forum virtually rather than at the fantastic facility that AstraZeneca MedImmune has offered us in Gaithersburg for the last 5 years. We hope to return to normal next year, but yet you'll find out when you hear our opening speaker here with her welcoming remarks that Maryland is really open for business right now. So I'd like to welcome one of our strong supporters and sponsors for this forum and has been ever since we started it 5 years ago. And we have the pleasure of having the Secretary of the Maryland Department of Commerce, Secretary Kelly Schultz, who's going to give us some welcome remarks to all of the people attending this forum this year. And from a basic background, Kelly has been in government, private sector, and also a small business owner. She previously served as the Secretary of Maryland Department of Labor, Licensing, and Regulation since she was confirmed in February of 2015. She was also a member of the Maryland House of Delegates, so she has a tremendous private-public background for her role as Secretary of Commerce. Secretary Schultz, welcome to the 6th Annual BioHealth Capital Region Forum.
Great. Thank you so much, Rick. Thanks to you and your team for having me again here today. So excited to be with all of you, and I know you're going to have a wonderful day, but thank you for the invitation.
Thank you.
Good morning, everyone. I'm Maryland Commerce Secretary Kelly Schultz, as Rich had said. A very happy and proud supporter of the 2020 BioHealth Capital Region Forum. Like a lot of things these days, this year's forum looks a little different, but there's still a fabulous lineup of speakers and panels, and I want to thank BioHealth Innovation for their entire team for putting this all together. A lot of our work at Commerce focuses on attracting new businesses and new investment to Maryland. And one of our biggest selling points is the state's thriving life sciences and biotechnology sector. With nearly 45,000 jobs paying $4.9 billion in wages and 2,700 private companies helping generate more than $18 billion in annual economic activity, the life sciences industry is one of Maryland's most powerful economic assets. The onset of the COVID-19 pandemic has shown a new light on the critical importance of this industry and its role in our future. As Governor Hogan announced in August, nearly 40 Maryland companies are developing and manufacturing vaccines, therapeutics, and tests for COVID-19, often working hand in hand with our leading research institutions such as Johns Hopkins University and the University System of Maryland. Maryland companies including Novavax, Emergent Biosolutions, Altimmune, Vigene Biosciences, and Longhorn Vaccines and Diagnostics, to name a few, have secured more than $5 billion in total funding to develop and manufacture vaccines for COVID-19. Some companies are developing their own vaccines, and companies in our important biomanufacturing sector are producing the vaccines developed by other companies. Last month, I was very pleased to join Governor Hogan on a visit to Novavax in Gaithersburg, where we got a tour and firsthand look at the incredible work being done there to help us conquer this virus. Even before the pandemic, Maryland Commerce wanted 2020 to be the year that we celebrate the amazing small businesses and entrepreneurs who are bringing the boldest new ideas to the marketplace. Now we feel that effort is even more important than ever. Our Innovation Uncovered campaign is using blog posts, videos, and social media promotion to highlight the most creative, innovative businesses Maryland has to offer. The centerpiece of the project will be the search for the Maryland Future 20. That's a list of innovative Maryland startups with the potential to become the state's next major business success story. We accepted nominations through the end of September, and we'll be announcing the final list in the coming weeks, so stay tuned for that. I want to close with a few words about how Maryland has endured during the pandemic. We've had to walk a narrow line, balancing the need to protect the health of our residents with their need to continue to earn a living and care for their families. We know that the restrictions and stay-at-home orders were big sacrifices to ask of our people and our business community, but they were necessary. And because we took those difficult steps, we have a solid foundation for our economic recovery, and we've been making great progress. Our unemployment rate continued to fall in August, dropping from 7.8% to 6.9%. That's more than 18% lower than the national rate. We added over 24,000 jobs that month and saw growth in nearly every industry sector. Our unemployment rate fell even while our labor force increased. This indicates Maryland is in a more stable economic position than the country as a whole. It's a sign of optimism in our recovery and hopefully will provide us with growth throughout the fall. So as we use today's forum to take stock of our biohealth industry's recent accomplishments and look forward to its future successes, remember that Maryland is in a strong position for continued growth. We are very much open for business, and our thriving biohealth sector is a tremendous source of strength. Thank you, Rich, to all of you, your team, and everybody participating today, and I know that you'll have a great day.
Thank you, Secretary Schultz. And you know what? It's very nice to hear some positive news during this pandemic. And I think your closing comments about how strong and vibrant the state of Maryland is at this time and how it's outperforming the rest of the country in many sectors is very encouraging for our region and for the state. So thank you very much for your opening remarks.
Thank you very much, Rich.
And another way that we can take this virtual world and help bring it to you, instead of being at AstraZeneca in Gaithersburg, Maryland, in Montgomery County, is try to bring a little bit of Montgomery County to you today. We're going to do that by asking the Montgomery County Executive, Mark Elrick, to give us some opening remarks for the 6th Annual BioHealth Capital Region Forum, which was held at AstraZeneca over the last 5 years. County Executive Elrick was elected in November of 2018 as County Executive. Prior to that, he had served in the County Council for 12 years and also had been a member of the Tacoma Park City Council from 1987 to 2006. And before that, he was 17 years as a teacher at Rolling Terrace Elementary School in Tacoma Park. So a very diverse background and very excited about the biohealth industry in Montgomery County. So with that, welcome County Executive Mark Elrick to the 6th Annual BioHealth Capital Region Forum.
Good morning, everyone. I want to welcome you to the 6th Annual BioHealth Capital Region Forum and welcome you to Montgomery County, Maryland, virtually. I would also like to express my appreciation to BioHealth Innovation and AstraZeneca and all of the sponsors of today's event. We are in the throes of our greatest healthcare crisis ever, but the response by researchers and those engaged in drug and vaccine discoveries is amazing. We are witnessing breakthroughs in our understanding of the disease, in the speed with which we can investigate how these viruses work, and we are seeing innovation at a pace that we've probably not seen before. I have to say that I'm deeply in awe of the science and the researchers who are working relentlessly. So I want to thank you and share my deep appreciation for the work that this community is doing. Over the last 30 years, Montgomery County embarked on an ambitious effort to become a hub for life science innovation and advancement. Today, the county is the epicenter of vaccine and therapeutic drug development, not only for COVID-19, but for a myriad of other diseases. Coupled with the combination of NIH and FDA, we can clearly say that Montgomery County is the vaccine capital of the country. There is no doubt that the concentration of intellectual capital in our biotech cluster has played an important role in our emergence as a leader in this field. The cross-fertilization of ideas that can occur in this environment is truly transformative. While I could not be prouder of the growth of the biotech industry in our community, we are planning and looking forward to the future and taking steps to ensure that the growth continues in the decades ahead. I plan to do this through several initiatives that I'd like to share with you now. First, we are pursuing a comprehensive approach to life sciences development at the White Flint Metro in conjunction with WMATA. Montgomery County has a great suburban presence. Now we need to develop an urban biotech presence, which we will be advancing in the White Flint area. Second, we want to attract a postgraduate academic or private research institution or institutions to our community. We have federal agencies like NIH and FDA that are important anchors, but it's very important for us to augment these assets with an academic or private research institution. And third, by strengthening the presence of related technology sectors such as IT, artificial intelligence, quantum computing, biodefense, and machine learning in the county, the growing marriage of electrons and wet labs is going to continue to transform research, and we hope to marry them in White Flint. Montgomery County is committed to being at the forefront of the future of the biotech industry, and I look forward to working with all of you to build that future together. Enjoy today's conference.
Thank you very much, County Executive Mark Elrick. You mentioned how it's at the epicenter, and one of our prior welcomers basically announced that we have received over $5 billion of BARDA warp speed money that has come into BioHealth companies in Montgomery County. Truly, it is one of the epicenters in the world for what's going on to address COVID-19 in this pandemic. And we know that we're going to be part of the solution for addressing this pandemic in the future. So thank you very much for coming on to welcome all of the attendees, sponsors, and participants in our conference this year.
Thank you.
Good morning again, everybody. And we want to introduce another critical partner to the BioHealth Capital Region. You've heard from Secretary Schultz from the state of Maryland and County Executive Mark Elrick from Montgomery County. And another critical partner for the BioHealth Capital Region is the state of Virginia. And we're pleased today to have the Secretary of Health and Human Resources, Dr. Daniel Carey, give some welcoming remarks to all of the attendees and listeners for this BioHealth conference. And Dr. Carey was appointed by Governor Ralph Northam in January 2018. Prior to his appointment, Dr. Carey was a cardiologist and served as, and is still a cardiologist, as the Senior Vice President and Chief Medical Officer at Centra, where his responsibilities were very broad. He also was the President and Chief Physician Executive of the Centra Medical Group. Something that a lot of people don't know about Dr. Carey is that he also spent 15 years as a major in the Air Force. And we thank you for your service, Dr. Carey, and everything you have contributed to America, not just as the Secretary of Health and Human Resources, but also for your military service. Lastly, he's a longtime Virginia resident. He's a graduate of the University of Virginia and Harvard Medical School and currently resides in Richmond. Dr. Carey, welcome to the 6th Annual BioHealth Capital Region.
Well, thank you so much, Richard, and what a pleasure it is to be with you here today to help welcome you. And good morning to all the attendees. It is my esteemed pleasure to bring you greetings on behalf of the Commonwealth of Virginia and to welcome you to the BioHealth Capital Region Forum. Virginia has a robust biosciences business community with over 2,000 life science companies and entities. Virginia's life sciences companies contribute over $8 billion to the Virginia economy. These contributions are critical to the Commonwealth as we continue to progress towards recovery from the COVID-19 pandemic. Continued innovation in biosciences will help Virginia and Virginians return to its economic, employment, and business activities to a healthy state. Virginia bioscience companies include all facets of bioscience: therapeutics, pharmaceuticals, diagnostics, medical devices, and vaccines. The Commonwealth has cited the life science industry as a key industry and is supporting it through direct investment into our companies. Today, you will see several Virginia companies and entities on panels highlighting our activities in the region. From Flow, discussing breakthroughs in advanced pharmaceutical manufacturing, to BrainBox, discussing advancements in traumatic brain injury diagnostics. to Vibrant Health on a panel about artificial intelligence and digital health, and many other Virginia voices. Virginia is a proud member of the BioHealth Capital Region, and we firmly believe that this region can and will be in the top 3 biohealth clusters in the nation by 2023. Thank you for your time, expertise, and talent, and the work that you do to advance the life sciences industry across the BioHealth Capital Region. Again, welcome and thank you.
Dr. Carey, Secretary of Health and Human Resources for the state of Virginia, thank you very much for your welcoming comments. And we know that Virginia is a critical component, that we will never achieve our goal of being number 3 without your full participation and contribution. So thank you very much. We look forward to working with you and John Newby, the president of Virginia Bio, and making Virginia a critical component and partner to the BioHealth Capital Region. Thank you.
Thank you so much.
Good morning and welcome to the October 19th, 2020 6th Annual BioHealth Capital Region Forum. You might notice a little difference this year. Instead of being in AstraZeneca's amphitheater, which we have done in the past 5 years, we're all meeting virtually. And thank you all for those who are in attendance at this conference, as we now have, and people are still registering, well over 1,000 people registered for this forum. And we think that's fantastic based on the environment that we're all in today. And we're really excited about this virtual forum because we have 59 excellent panelists and keynote speakers for you that you'll be able to hear during the day, talking about those things that are relevant to continue the growth in the BioHealth Capital Region, as well as trends that are happening within our industry. And as you know, I generally give a little update at the beginning of every forum on what is the state of the union for the BioHealth Capital Region ecosystem. And so let's progress and talk a little bit about what we've accomplished in the past year, where we are today. And to be honest with you, it's almost 18 months now, because our last forum was in April of 2019. This is October 2020. We hope to get back on a regular schedule next year, but a lot of that is dependent, as you know, on the COVID-19, the pandemic, vaccines, and other things that will affect our lives in the future. So we're all hoping for positive results there. And we also know that the people in our region are going to be significantly involved in coming up with some of those solutions, cures, diagnostics, vaccines for this pandemic that's affecting all of us. So let's start with a little bit of thank you first. We've had an excellent virtual planning committee this year with representatives from AstraZeneca, Wilson Sonsini, Virginia Bio, BHI, J&J, AURP, JP Morgan, Children's National, State of Maryland, Emergent Biosolutions at George Mason University, and also TaylorMade, which is really our organizer and the people that you don't see that make this thing work. In addition, we really want to thank the sponsors for this virtual event this year. We have 45 sponsors. It would take me too long to mention all of you. And to be honest with you, we think this is fantastic in light that this is a virtual conference, that you sponsors have stepped up again, recognizing you may not have the same contact person to person that you've enjoyed in the past when we have in-person events, but we hope to get back to that in 2020. So thank you to all of our sponsors for the 2020 6th Annual BioHealth Capital Region Forum. We also have a number of regional support organizations that are working together very effectively in our ecosystem. In addition to BHI, we're working with the Maryland Tech Council, Marty Rosendale, in the District of Columbia, Children's National, Kalela Eskadanian and Kurt Newman. TEDCO has a new CEO, Troy Stovall, who has just joined recently, and also John Newby from Virginia Bio. Thank you all for your support and your partnership in the BioHealth Capital Region. The goals of this forum hasn't changed from what we have done in the past, and we hope that our region's leaders in the biohealth industry will help create many new connections, share the developments with one another, create new partnerships, continue to evaluate our strengths and opportunities where we can improve, further develop the vision and identity for our region, and we are really developing a strong brand with the BioHealth Capital Region brand now. And more importantly, this year, a new goal for the region is to develop vaccines, therapeutics, and diagnostics to address the COVID-19 pandemic. We'll talk a little bit later how influential the BioHealth Capital Region is in achieving this. We also hope that the BioHealth Capital Region initiative leaders will report the progress against our goals last year, and then also we'll set some new goals for the next year. And of course, our overriding goal is to be a top 3 biopharma cluster in the United States based on the GEN rankings by 2023. And we hope that we can accelerate that time frame. Talking about GEN and the latest ranking that was done in 2019, we are 4th. And as you know, in the past, when we've reported, we were 6th about 4 or 5 years ago. We've improved to the 4th leading biopharma cluster in the United States, with only Boston, San Francisco, New York ahead of us. And the criteria that's used is NIH funding, venture capital, patents, lab space, and jobs. We're going to summarize some of those and what the updates are for the BioHealth Capital Region for you today. Also, this was a report published in GEN about the strengths of our region in September 9th, 2019, about a year ago. We know that they're in the process of updating the ranking report as we speak, and hope to have some news about where we are during this conference. Rather than read everything there, it basically states that we are making significant progress in most of the categories that we are ranked in. And of course, one of the areas for improvement, which will always be one that we would like to achieve a greater scope in, is the addition of early stage capital and venture capital for our region. But as you'll see later, we are making some very good strides in that area as well. The brand BioHealth, which was created by BioHealth Innovation in 2011 and adopted as the BioHealth Capital Region in 2015, is picking up momentum not only within our region, but nationally and internationally, as the term has become a new state of art rather than biotechnology or life sciences, because we believe the convergence of biopharma, medical devices, electronic cybersecurity, AI, quantum computing is better reflected with the BioHealth brand rather than referring to the old terminology of biotechnology or life sciences. But the most important thing, now that this is being adopted globally in some areas, it's nice to recognize that it all started here within our BioHealth Capital Region. I want to thank JLL as well as Shear Partners for updating some data for us that we provide to GEN, Genetic Engineering News, on the state of where we are in the BioHealth Capital Region around some major statistics. And it's very reflective, as you can see with the coronavirus image here, and what have we accomplished, especially in the last 6 months during this pandemic period. From a Mid-Atlantic perspective or a BioHealth Capital Region perspective, it's good to see that we have 23 million square feet of wet lab space located within our region. This is very significant, and one of the things that we found out this year that we haven't had in the past is there's new spec wet lab space being developed in our region, and that's only being done because people believe there is significant growth opportunities and developers are willing to invest their dollars in a speculative way to develop new space that we need. The reason we need it is, if you look at our primarily the Maryland market right now, our vacancy rate is 4%. If you really are looking at trying to attract and grow major companies, that means we need to have additional new office space available. And then based on the coronavirus, one of the other contradictory statistics is the vacancy rate around traditional office space or commercial space is 17%. And hopefully that will improve in 2021 once we are able to address the COVID-19 pandemic. But one of the things we're seeing is some of the traditional office space is being converted to wet lab space. The other thing that's impressive for our region is if you look at the average rental cost in the Mid-Atlantic area or the BioHealth Capital Region, you can see Maryland is located in the moderate zone, and that really reflects our whole region. And if you look at the three regions ahead of us, Boston, San Francisco, and New York, their rental rates are twice as much as what it is for biohealth companies to occupy space within the BioHealth Capital Region. This is still very inexpensive to compare to other major markets, and we think that gives us a significant differential advantage, which we're able to maintain. The other thing that's exciting to look at over the last 5 years, venture capital and grant funding has grown 5 times from 2016 to 2020. That's excluding the funding rounds that were produced through Operation Warp Speed by BARDA, which we'll talk about in a second. So from where we were in 2016 to where we are today in 2020, we've had a 5x improvement in the amount of venture capital that comes into our region on an annual basis. While that is impressive, it still says there is room for improvement and additional growth in the future. Here's one of the most exciting things to talk about in 2020 for our region. Unfortunately, it's due to the COVID-19 pandemic, but the top 10 recipients of Operation Warp Speed funding from BARDA, it is impressive to see that 5 of them are represented in the BioHealth Capital Region with GSK, Novavax, AstraZeneca, Emergent, and Flow in Richmond, Virginia. So it's amazing to see that with these 5 companies plus additional companies in our region, almost $7 billion has been invested and committed to our region in the last 6 months, which is greater than any other region in the United States or the world to address COVID-19 vaccines, diagnostics, and therapeutics. Very impressive for our region. In addition, here's another 14 companies, some of those which we've already talked about, who have received COVID-related federal funding that brings this total, when you add all of this together with those top 5, of over $7 billion. And this is very significant as it relates to some emerging companies as well as some of the well-established companies. There is no question we are the epicenter for looking for some of the cures, vaccines, and diagnostics related to the COVID-19 pandemic. So congratulations to everybody in the region and the work that you're doing that will have a benefit globally. In addition to that, it's always good to reflect on how much public money has been raised within our region. And this is just year to date in 2020, 1.2 billion in public offering rounds have been raised in the BioHealth Capital Region. Now, since this has been prepared by JIL in the commercial real estate business, they see this as great for future tenant demand. I also see it as reflective that investors, investment bankers are also seeing that the companies in this region are worthy of attracting public funds, and the companies are doing well in achieving new rounds of public funding. So congratulations to all the companies listed in this 1.2 billion that's been raised. More impressively, we have 16 companies in the region that are in phase 3 clinical trials. We all know how difficult it is to get to a phase 3 with the FDA in clinical trials, and it's impressive to see these 16 Maryland-based companies who are all at a phase 3 in clinical trials, and that number continues to grow. It also breaks down those in phase 1 and phase 2. So companies, a lot of these companies have many technologies or therapeutics that, or diagnostics or medical devices that may be at a different stage, but the most impressive thing is how many have reached the phase 3, which, as you know, takes a lot of money and time. Some of the recent company funding successes located in the BioHealth Capital Region. I'm not going to go through all of these, but what's impressive is we're starting to get some rounds that rival the size of Series A and Series B's investments that you see in Boston and San Francisco. This continues to grow as people understand the quality of the assets and the companies we have in this region, which means we're attracting many top-tier venture capitalists to invest in companies within our region. Also, once you get the venture capital or in that investment, the other thing that the investors look for is what type of exits are there once you've invested in a company. We've had many successful recent exits in the BioHealth Capital Region, Maryland and DC and Virginia. Again, some of these have been very significant, but the most important thing about these exits or acquisitions or mergers that have occurred, the majority of the companies that have been acquiring or have merged have maintained a presence in the BioHealth Capital Region rather than leaving the region. And I think one of the reasons for that is people understand we have one of the top talent and highest educated biohealth regions in the United States. And the other effect that we're having is we have a cluster effect now where someone doesn't have to worry about relocating to this region with one company and not being able to find a similar job with another company in the region. And I think that that's growing and reflective of new entrants to the region like an Autolus and a Kite who have set up operations in their CAR-T and cell therapy space, and they were attracted based on the quality of the cluster as well as the talent that we have here. That gives a little brief rundown as to some of the major accomplishments in 2020. And as you know, we are also going to do a crab trap competition again, which is our version of the Shark Tank, which will be held on Wednesday, the 21st at 12 o'clock. And everybody that has registered for the BioForum is eligible to watch and tune in to this live crab trap competition. The 5 finalists this year are BrainScope, CarTech, Creative Biopeptides, Inara Health, and Kalocyte. And a very diverse background of companies geographically as well as technologically. And we wish them all well, as we know that the winner of Crab Trap in the past, which have been Sonovax, LifeSprout, Galen Robotics, and Florio, have all had significant progressions with their companies in the last 4 or 5 years based on their winning the Crab Trap competition. We know it's not due to Crab Trap just by itself because the amount of funding is nominal, but the exposure that they receive, the networking that they make, and the contacts that they have with our top tier judges from the venture capital industry has benefited all of the previous winners. We also want to thank Wilson Sonsini, who is the sponsor that presents the $10,000 check to the winner that we will announce approximately at 1 o'clock on Wednesday, the 21st. So good luck to all of this year's applicants. Last year in October, we had a 2019 investment conference sponsored by JP Morgan, Wilson Sonsini, AstraZeneca, BHI, Deloitte, and others. We had 148 invited companies and 45 invited investors. This year, we are having the 3rd annual BioHealth Capital Region Investor Forum on October 20th and 21st. It's by invitation. We will have a similar amount of companies who are going to participate. And something that's very exciting this year is instead of 45 investors, we have 59 investors who have registered for this October 20th and 21st investor forum. We expect that there will be several hundred one-on-one meetings that will occur between the investors and the companies. And we've had some significant successes in past years of companies who have met a new investor for the first time at this investor conference and actually concluded in a financing round sometime within 6 to 9 months after that first initial meetings. We also want to thank the sponsors for this investor conference on October 20th and 21st, AstraZeneca, BHI, Deloitte, J&J, J-Labs, JP Morgan, Montgomery County Economic Development Corporation, and Wilson Sonsini. So stay tuned for hopefully some significant results that will come out of this investor conference, which is also our attempt to shine the light on the great assets, companies, and entrepreneurs we have in this region. Normally at this time, I would talk about save the date for the 2021 BioHealth Capital Region Forum. What we want to do is to leave that open because we're hoping that we can get back to normalcy in 2021. In doing so, we hope to have a live event rather than a virtual event. So rather than determine a date today, we will reserve that in the future. Hopefully that we have made significant progress with a COVID-19 vaccine, diagnostics, contract tracing, so that we could have a successful in-person event. And stay tuned, we'll announce what will happen with that later. For the next steps for our BioHealth Capital Region we're going to continue to market our brand, trying to strive to become a top 3 biohealth hub by 2023. Try to continue to increase our collaboration. And one of the things that's noticeable is the companies within our region collaborating during the COVID-19 pandemic. You see Emergent, AstraZeneca, Novavax, GSK, Altimmune, and many companies who are working with one another, whether it's on manufacturing or research or diagnostics, in working with one another, even though sometimes they may be in a competitive environment. We encourage this increased collaboration and partnership. We also want to leverage our extensive assets, accelerate commercialization, and grow our cluster as we are continuing in the last 5 to 6 years in the BioHealth Capital Region. And one of our standards in closing is a call to action to all of you. As you know, I like Jerry Garcia, Grateful Dead. He had a great quote: somebody has to do something, and it's just incredibly pathetic that it has to be us. That hasn't changed year to year. The us is still you, and I think we're doing a fantastic job in increasing this collaboration with one another in the BioHealth Capital Region. So please keep up the good work and keep trying to work and collaborate with one another. I want to thank everybody in the region and the organizations that are involved. More importantly, the employees who make this a great place to live, work, and play. And lastly, I want to thank Tailor Made Experience, who has helped orchestrate our first and hopefully last virtual conference, as we hope to get back to live conferences in the future. So thank you to all, and I hope you have a fantastic day with the great speakers that we have on our panels and our keynotes. One thing I'd like to do now is to basically talk a little bit about logistics, and I'll just summarize some of those things for the day for you. Our panels will be taking place in the Agenda tab in the menu on the left side of the screen. You can add a panel to your agenda by clicking the plus add to your agenda button, or click the current session button on the home page to join the session in progress. While we highly encourage everyone to join the live conference to take advantage of the chat and networking opportunities which have previously been discussed with you in prior releases, we understand that some of you may not be able to attend the full forum, or you might miss a significant panel or keynote. You will be able to access the panel recordings on EventMobi for up to a month following today. If you submit a question in the chat of a panel by October 26th, you will receive an answer and follow up with one week. We guarantee that every question will be answered by a panelist to whom it is addressed. Also, please visit the FAQ tab for any additional questions or contact information if you need to contact anybody specifically. So with that, I'm going to close our opening. Thank you all for your participation. Thank our speakers, our organizers, and our sponsors, and hope everybody has a great 6th Annual BioHealth Capital Region Forum.